Hello everyone, this is Dr. Ibrahim. Hope you are doing okay. In this video, I will talk about one of the common station in PLAB 2 exam, which is a problem with your colleague. This is a very common station, and it will be easy to tackle if you know how to deal with the station. So, first of all, in this station, so you will be informed, or you will notice that there is some incident happen by one of your colleagues that might compromise the patient care. Okay, you might notice the incident yourself, or you might be informed by one of the people in the system. It could be your senior, it could be one of the nurses. She might tell you a story about one of your colleague. Okay, so first of all, it is a story. It is a story, so you need to make sure that the story is right. So you will need to take some history from your colleague. um, and one of the most common mistake that people do, it is a very avoidable mistake and very common at the same time, is that people will start to be harsh and judgmental in such kind of station. The most important point to keep the patient safety as your first priority in this station, and at the same time to be nice to your colleague. Okay, I would say be helpful. Okay, and deal with the situation as a teaching station, not literally a teaching station, but you will need to take history about what happened, to acknowledge, to explain the incident to your colleague, and to find a solution for what happened. So the right approach is take history first of all, uh, take history about the incident, and sometimes your colleague might not give you a good history. So at some point you might need to confront him in a nice way. Okay, and after that to explain to him, to explain or to gain information why he have done this, or why he have been through this. Like, there is a problem, colleague with problem with alcohol, drug abuse, dealing very badly with some patient, breaching confidentiality. Okay, coming late to, there is many issues. It's not only the issue that is the station that is written in the notes. There is many station that might come in that aspect. So you need to first of all to know why this happened, to know the reasons. Okay, to know why the patient was your colleague was aggressive to one of the patient, why he breached the confidentiality, like he did a post on Facebook, or he discussed one of the patient information outside the healthcare system, or even inside, but outside the allowed circumstance for the information of this patient. So you need to acknowledge that, and after that to explain about the problem. Sometime your colleague might he might not know about the problem, like he breached some confidential information and he doesn't know that it is confidential information. Or just don't assume that he know and he did it himself. Okay, don't assume that, just explain to him, gain information, explain that this is confidential information, or this is wrong, or it's not good to come late to the hospital, or it's not good to deal with a patient in this way, or it's not to work under influence of alcohol or any other drugs. So explain it in a nice way, take it step by step, don't throw all your cards at one shot. So and explain why this might affect the patient safety and might compromise the health care. You have to explain, and after that find the solution. Now you have two patients. The first one is the main patient that the problem with your colleague affected him. So you have to treat this first, like to tell your colleague to explain to the patient about the mistakes that have been done, or the problem, or to give an apology, or to like examine the patient, to see the patient again that your colleague have seen. You have to do something regarding it, and to ask your colleague if it is needed to stop working, to take day off in some situation, um, and he might need to do an incident form about happen. and for sure he will need to escalate this to the senior. He might need to speak to the senior, the consultant, at that situation. And the most important point, you need to make sure that your colleague will not do this again in the future. Is not only by advising him, please don't do that. No, you need to find a good management plan. Like for a patient that doesn't know about for a colleague that doesn't know about the confidentiality of the patient, he might need to know to read the JMC guidelines regarding that. If one of your colleagues came to the work under influence of alcohol, you might need to read the guidelines regarding that also. So you need to find a management plan. Some of your colleagues might be depressed, might be in some tough situations. That's why he came late, or he is having alcohol nowadays. So you have to find this also and to help him. You might need to advise him to go to the GP, to give him general advice to help him. So as I said, helper attitude in this situation is more better than judgmental attitude. This is a very common station in the exam, and it is easy to be tackled if you will be nice in the situation. Okay, see you in the next video.